Well, hello. Welcome to another episode of Perfectly Twisted. I'm Nicole Eggert. This is Dave Palais over here.
Good to see you, Nicole.
Good to see you as well. What's going on? Anything?
You know what? The weather's getting really nice. All of a sudden, it's starting to feel like here comes the good stuff. Like we've gone through
Oh,
a lot
God.
already this year, not only in Southern California, but I know throughout the country, whether it's, people are fighting tornadoes. We've had our share of fires, but all of a sudden it's starting to feel like, hey, here comes the good stuff. We're going through a good part of spring and summer and all the good memories.
You know what, Dave? You sound like a privileged, spoiled brat.
I thought I was doing really good right there. I don't know what to do.
Yeah,
I'm
good for
sorry.
you. You live in Southern California. So wait, have you caught this show? Farmer wants to get married. Farmer wants a wife.
No.
A good show this does not make. I fall asleep. I turn it on and I completely fall asleep immediately. It's my sleeping pill. But I thought, oh, this is so great because these are such good guys. There's these really good looking, hardworking farmers. They're looking for a real thing. And in real life, these guys are probably amazing, just amazing. For TV, I mean, snooze fest. So I didn't know if anybody else has caught it. 3 episodes in, I don't think I'll be continuing. It's just
That is funny.
what a snoozer. But
That's
super
what, no,
excited. Handmaid's Tale is their final season. I don't know if you watched
no.
that series, Handmaid's Tale. Huge Hulu show from the novel. It's just, I love it. It's where our world is headed, unfortunately. It seems like real life, and that's scary, but their final season is but it's one of those shows where they took such a long break that I feel like I need to go back and watch the last season to catch up again, like
Okay.
a refresher. Yeah, so I don't know who else is excited out there for that, but I am. You know what else I'm excited about? I'm excited about our guest today. I was doing a podcast for an old friend named JJ Virgin. She has a podcast. She's a health guru. And I had worked with her after I had Keegan when I was 40 and gave birth, and my body went crazy. And she was one of the first people who said to me, there could be something different than just diet and exercise. And she introduced me to doctors, and we started, looking at blood work, as in looking at weight loss like that, which was new and, opened my mind so much. Well, anyways, I was guesting on her podcast, and she said to me, you have to meet my friend, Dr. Jenn Simmons. And so I said, okay, great. And I immediately text Dr. Jenn Simmons, and she says, we were at the same event last night.
Wow.
It's like, this world is so small. And so we were so destined to meet. She sent me her book. I couldn't put it down once I picked it up, and we get to talk to her today. So, and men, please do not tune out on this conversation, because you could be this could benefit you health-wise as well. Although you're not looking at breast cancer like we are as women, but you also can help the woman in your life. You might be that little bit of a nudge that your mom, your sister, your wife, your friend needs, your cousin, whoever, your coworker. They just might need that little nudge of you checking in, going, hey, have you done this? How are you doing this? This, I'll go with you, or we'll celebrate after. I don't know, any of those things. So men, don't check out. But let me introduce Dr. Jenn Simmons. She's the author of The Smart Woman's Guide to Breast Cancer.
Hi, thanks so much for having me. And, I just want to put out there that the men shouldn't check out because we're talking about the same disease. So if we talk about breast cancer in women, we're talking about prostate cancer in men. And it's the same things that are happening in, on, and around us that is driving the explosion of the disease in both sexes, right? And we're not only seeing breast cancer in younger women, we're seeing prostate cancer in younger men. And I know everyone wants to blame it on estrogen and blame it on hormones, but in both cases, in the case of breast cancer and in the case of prostate cancer, it is far more a disease of hormone deficiency than it is of hormone excess. And all of these things that are happening around us, I'm sorry, I barged in here.
Love it. Love it.
Perfect.
But all of these things that are happening around us are happening because our hormones are becoming imbalanced, and our innate endogenous hormones, the hormones that our body is making, that are made by the ovaries and made by the testicles, they're getting depleted by all of the things that are going on in our environment, and we have the disease to show it.
We sure do, and we have the infertility to show it as
Yes.
well. Mhm.
Yes. So, my world of breast cancer, and we can certainly talk about how I got here, but my world of breast cancer is like 10 or 20 years ahead of the people who are taking care of patients for infertility, because it's that dysfunction that is never properly dealt with. I mean, think about what happens when people experience infertility. They go to fertility doctors, and what happens? They get a pregnancy forced upon them, right? Like they take the sperm and they take the eggs and they put them in a petri dish and give them back to the person and give them hormones to support them through the process, and never ever do they ask, why is this person infertile? Why isn't she ovulating? Why can't she sustain a pregnancy? What's going on with her hormones? Because fertility is health, right? Like, your body is not going to bring another human being onto the earth unless you're healthy. So fertility is a sign of health. And what are we doing? We're taking that person whose body is saying things aren't right, and we're forcing a pregnancy on them. And then they get 10, 15, 20 years down the line, those issues were never resolved. And now we're talking about breast cancer.
Yeah.
And
Mhm.
everyone wants to blame the fertility drugs. It has nothing to do with the fertility drugs. It has to do with the reason why you needed the fertility drugs. Because it's not normal to need fertility drugs. It's not normal to need fertility treatments, right? Like, we're kind of put on this earth, and that is something that we are supposed to be able to do on our own.
100%. And Dave, may I point out, what kind of listening device is Dr. Jenn using?
Oh, Dave, you're on
Dave, you're
mute.
muted. You're muted, my friend.
Sorry. Look, I took them out. I'm not even
Okay.
using them. I'm just using. Look, Nicole got into my
Oh,
head,
does
ruined
he
my
use
entire world.
wireless?
Yes.
Oh, oh,
I could,
I
I literally,
know.
I can feel everyone's eyes rolling right now. Look, I didn't know. I didn't know. I was educated, but I took them
Yeah.
out. I'm literally doing it
Yeah,
without
good.
the
Yeah.
earphones.
Listen, it's a no judgment zone, but there are
BS. It's a
so
total
many
judgment
things.
zone.
No, it's not. It's not judgment. I mean, I actually like applaud you for being able to hear that and changing, right?
I
Because
know. I'm so proud of you.
a
Yeah,
lot of
thanks.
people are totally resistant to that, in that if you can't see it, all these intangibles, they're like, yeah, whatever, conspiracy theory. And
Yeah.
then you interview someone like Nick Pinault. Do you know who he is?
I know the name.
He's like the EMF guy, right? And you interview someone like him and you're like, I'm never using a Bluetooth device ever again. Like, he scares the crap out of you. But
Well,
it's very real,
it's very real.
right?
Ask Dave, when I got my diagnosis, see, like, I don't have a lot of education. I was SED schooled. I don't have a great education, but what I do have is really great intuition. And the first thing I did was rip off my Apple Watch. I turned off my Wi-Fi, and Dave, everybody was like, "Are you okay? Are you going to be okay?" And I said, "Listen, I just don't know. I don't know," because I stopped and started looking at everything around me. And my watch freaked me out. The Wi-Fi freaked me out. The food I was eating, I didn't want to eat. I started fasting. I went vegan, and everyone was like, "Okay, Nicole," and my doctors are like, "No, we need you to eat. We need you to eat. We need, and just all the things. Stop taking supplements. No vitamins." And I wanted to do the vitamin C drip. My doctor says, "No, no, no, no." And so when I read your book, I just felt so heard and so validated and so enlightened, and just because you take it to the next level. I have a list of things that I need to order. And like I had just recently got the castor oil, which I was researching and doing, but I was just doing my feet. So now obviously I'm going to do my liver and my breast.
Yeah.
Um
And your thyroid.
and my thyroid, all these
Mhm.
things.
Yeah.
Yeah. And like the infrared blanket, I didn't realize they were so affordable. I
Yeah.
will, for everybody out there, I will put it on my Amazon list. They are affordable.
Yeah. Yeah, they are. Yeah. And you can go in stages, right?
Yeah.
And because some of the infrared saunas are more of an investment, but I mean, you can get an infrared sauna blanket and start there for $500. You can get one of the relax sauna tents for $1,500. And, then you can go up to like the 2 and 3 and 4 person units, freestanding units that are $5,000 and $10,000. But you can do these things very affordably, and there are also so many things that you can do for free. Like
Yeah.
if you cannot afford that sauna blanket right now, fine. But you can take a hot bath with magnesium salts at night, right?
Yeah.
Or you can do castor oil packs. They're very inexpensive. Or you can get a rebounder, right? Like one of those mini trampolines and jump for 5 minutes every day. You can get a dry brush. They're $2. Get a dry brush and do lymphatic massage before you get into the shower. If you're getting massages already, why not get a lymphatic massage instead of that typical sports massage so that you're really moving your lymph around and doing circulation? You can do your own breast massage every night. That is one of the things and one of the reasons why we see so much breast cancer is that we live very, very, very stressful lives now, right? And we only inherently know two states. We know safety and we know danger. And the only danger that we can perceive is historic danger. Like our system has not caught up with modern times. We are modern beings living on a very old gene code. So the only danger we understand is a saber-toothed tiger that's chasing us. And every single thing that we perceive as stressful, we perceive as a saber-toothed tiger chasing us. So our body goes into this like fight and flight mode where our circulation shifts and it's all shunted to the legs so that you can run away, right? That's what's happening. And so if that's happening, that the circulation that would go other places, other less necessary places, doesn't happen. So most of us are in this fight or flight mode for 50% of our day just because of the busyness and the deadlines and our cell phones and schedules and all of that. Most of us spend a significant amount of time in fight or flight. So during that state, the blood is shunted away from our breast. So any toxin that is stored there is just kind of sitting there, stewing, right? So one of the greatest things that we can all do is breast massage every day because that allows for the circulation of toxins out of the breast into the system, and then your system has to detoxify it. So, but at least it has a fighting chance if you're doing massage.
Yes, and you can also do your own. I do my own lymphatic massage because a lot of
Yes.
people, I get it, we're on a budget and there are so many things and it's so
There
expensive.
are.
So, and you know what? I got a little overzealous and I want to tell the audience that Dr. Jenn was a breast surgeon and you can add to this. This is just what I know is that she was a breast surgeon and started learning about functional medicine and left her practice and you're an integrative oncologist now,
Mhm.
correct?
Yeah. Yeah.
So what that
Um,
means for a lot of people like me who didn't really understand is that she does ask the questions of why and how did we get here and like my listeners know that I had a lot of frustration with my doctors. I realized right off the bat they had no idea outside of the realm of just administering the chemo to me. There
Yeah,
was
of course. I knew that the second that they said to you, don't fast
yeah,
and don't go vegan, because they don't know anything. And I'm saying I'm coming from a really pure place in that I have the same training they did. I'm an MD, and I went to a very conventional medical school, one of the top medical schools in the country, and we had 15 hours worth of instruction around nutrition, and it was mostly talking about diseases that we don't even see anymore, like scurvy and rickets, from profound vitamin C and vitamin D deficiency, which we just don't see it anymore, and like kwashiorkor from protein deficiency. I mean, things that we don't see anymore. That's what we learned during our 15 hours. And then we never talked about it again. Never, ever, ever, ever do we connect what we put in at what we eat and what we drink to our health. It's crazy, right? It's
yeah,
crazy considering that 80% of our contact with the outside world is through what we eat and what we drink. How could it not have any importance? Right?
yeah,
And when you think about it in the cancer realm, and I come from a breast cancer family. I didn't find breast cancer. Breast cancer very much found me. And growing up, I had a first cousin. Her name was Linda Creed. She was a singer-songwriter in the 1970s and 1980s. She wrote all the music for the Spinners and the Stylistics. She wrote 54 hits in all. And her most famous song was The Greatest Love of All. So she wrote that song in 1977 as the title track to the movie The Greatest, starring Muhammad Ali. But it really received its acclaim in March of 1986 when Whitney Houston would release that song to the world. And at that time, it would spend 14 weeks at the top of the charts. Only my cousin Linda would never know, because she died of metastatic breast cancer 1 month after Whitney released that song.
ugh,
I was 16 years old and my hero died.
I'm sorry.
And her life and ultimately her death gave birth to my life's purpose, because I never wanted another woman, another family, another community to have to suffer the way that mine suffered. And so I did the only thing I knew how to do. I became a doctor, the first doctor in my family. I became a surgeon. I became the first fellowship trained breast surgeon in Philadelphia. I became the first oncoplastic surgeon in Pennsylvania, and I did that really well and for a really long time. And I did it long enough for my aunt to be diagnosed and long enough for my mother to be diagnosed. And with all the writing on the walls, I'm in my 15th year of practice, and I go from probably being one of the most high performing people you could ever meet to I couldn't walk across the room because I didn't have the breath in my body. And I undergo this intense workup. And at the end of 3 days, I find myself sitting in the office of my friend and colleague and physician. And he tells me that I need surgery and chemo and radiation, and I'm going to be on lifelong medication. And believe me, I appreciated the irony, because these are things that I said all day, every day, without hesitation or reservation. But I can assure you, when these words are coming at you, even as a physician running a cancer program, they have different meaning.
Yeah.
And in that time and space, the only thing I could hear was a voice in my head telling me there's something more, go find it. And I did not know of something more. I never heard of integrative medicine. I didn't know what it was. I never heard of naturopathic medicine. All I knew about was the kind of doctor that I am, right? So I go on this quest to heal myself. Has nothing to do with my breast cancer patients. This is like how I'm going to live so that I can raise my 2 young children. And my husband hates it that I leave him out of that conversation, but in any event, and God is good. And in a matter of weeks, I found myself sitting in a room, and this tall, lanky guy walks on stage, big toothy grin, and he introduces himself as a functional medicine physician. Now, at this point, I'm a doctor for 20 years. I'm still cynical. I'm like, there's no such thing as a functional medicine physician. What is this quack talking about? And then I remembered that I'm sick and I'm there for a reason. So I check my ego at the door and I tune in, and thank God I did. Because within the next 2 hours, not only would I learn how I was going to heal myself, but I also learned what I was going to spend the rest of my life doing and the impact that I was truly meant to make. So I learned that day exactly why I got sick. I got sick so that I could be in that room at that time listening to this man speak. As it turns out, the man is Dr. Mark Hyman, who now is pretty much a household name. But in 2016, I had no idea who he was. And what he had to say, which was so profound to me and now seems so unbelievable that we're not asking these questions. But, what he was talking about was root cause medicine. And especially in the area of cancer, where all of our focus in the conventional medical realm is on the tumor. But the tumor isn't the problem. The tumor is the symptom of the problem. And it's what caused the tumor that we need to be thinking about. It's what caused the tumor that needs the intervention. And so I'm an early adopter. I get really, really excited. So I that day enroll in the Institute for Functional Medicine, and I spend the next 3 years just submerged in the study of functional medicine and trying to heal myself, which admittedly was probably not my best of ideas, in that I should have gotten help, and I should have gotten help way sooner because I got a lot worse before I got better. But in the end, I looked up 3 years later and I was healed, and it was a bell that I couldn't unring because I knew that staying in surgery, I was only taking someone from one sick place to another. I wasn't changing the trajectory of their life. I wasn't helping them to be healthier in any way, shape, or form. What I was doing was delaying the inevitable. And so I started a functional medicine practice called Real Health MD, where I'm helping women with a history of breast cancer to truly recover their health. And so, fast forward 6 years, we've undergone a lot of evolution at Real Health MD. And I wrote my book last year, The Smart Woman's Guide to Breast Cancer. That's the book that you're talking about. And I wrote this book because thank you. Women who get a breast cancer diagnosis get immediately thrown on this freight train of treatment, right? They get signed up for surgery, and they're getting chemo, and they're on anti-hormonal drugs, and they're getting radiation, and nowhere are they getting informed consent. Nowhere are they understanding the disease and what might have caused the disease. And they're also not really being informed about the short and long-term ramifications of many of these treatments. And it's a problem because right now we have 4 million women living with a breast cancer diagnosis in the United States. That's just the United States, 4 million women. And most of the treatments for breast cancer, not all, most of the treatments for breast cancer accelerate brain disease, accelerate heart disease, accelerate bone disease, and have a whole host of side effects that are not discussed fully, and are justified for the purposes of saving your life. And if in fact they do save your life, then maybe it's necessary. But we're talking about a minority of patients there. And most patients are overdiagnosed, overtreated, and then told that they should be grateful to be alive. And they are grateful. Don't get me wrong, they are grateful. But it is very hard to feel grateful when you're depressed, when you're anxious, when you're scared, when you can't sleep, when you can't think, when you can't remember your words, where your body aches, your bones ache, your joints ache, you're tired, you've gained weight, your clothes don't fit, you don't feel like yourself, your breasts are deformed or absent, you have no libido, your relationship is suffering, sex is unwanted and painful, your hair is dry, your skin is dry, everything is dry. You don't feel like yourself, and this does not feel like your life. It is hard to feel grateful when all of that stuff is happening, and yet that is how we are leaving most women after breast cancer treatment. And we know better, and we can do better. We can do a lot better, and we can do a lot better before, and we can do a lot better after, but it doesn't serve the system. And right now, breast cancer treatment is designed to benefit the system and not the people in it.
Yeah. It's funny because in a lot of patients, it falls on deaf ears a lot too, I've noticed. Like, I was incredibly freaked out about getting radiation, and nobody could understand why. And they're like, "It doesn't hurt. What's the big deal?" And I was like, "Are you?" But yet, I'm someone who doesn't really use a microwave anyway. Like, I don't. I've never. My daughter doesn't. My daughter had said to her friend, "God, you put everything in the microwave," and my
Yeah,
kids understand it because
it's
they've lived
horrifying.
without one. They don't use a microwave. So to go under radiation, I was completely devastated. It was one of the hardest parts of my treatment, was to say, "Okay, I'm going to do this."
Yeah,
And nobody could understand why. They were like, "It's nothing. It's a breeze. Pretend you're going to the tanning salon." I heard the craziest things coming out of
yeah,
people's mouths.
yeah.
And I said, just because it doesn't hurt does not mean that it's not damaging
Right.
and ruling
Just
inside
because it
my
doesn't
body.
hurt doesn't mean it's not hurting you.
Yes.
And so we have to take that into account, that we know, first of all, radiation is a known carcinogen, right? So the more radiation you have, the higher your chance is of getting another cancer, right? Beyond that, radiation has profound negative effects on the tissues. So, depending on if you're a left sided cancer or a right sided cancer, there are a lot of important tissues that are beyond the breast or beyond the chest wall. The chest wall itself, yes, it has muscles. And when you radiate that muscle, you change the blood flow to the tissues. So, you really harden and firm the tissues. And there's lots of people that get something called chest wall syndrome, where they have horrible chronic pain from the hardening or firming or fibrosis of the chest wall muscles. And then beyond the chest wall muscles, there are the ribs. And when you radiate the ribs, you really make them quite brittle. So people can have a rib fracture from a sneeze, from a cough, from a minor fall. And we see this happening all the time, years out from radiation. Rib fractures have their own fatality rate. Rib fractures are very serious and can be very serious. So we can't discount that. And then, of course, there's the lung,
Yeah.
right? So if you affect the lung and you cause chronic breathing problems, chronic oxygenation problems, that is going to affect your stamina, your energy, how you feel, how you oxygenate. Oxygenation is one of our protections, one of our protective mechanisms against a future cancer. So if you're not oxygenating, that increases your risk of a future cancer. So the lungs are really important, right? We don't want to damage them unnecessarily. And then, of course, if it's a left sided cancer, there's the heart. And there is a 2 to 3 fold increase in heart disease in women who have been treated for breast cancer because of the chemo, because of the anti-hormonal treatments, and because of the radiation, which directly damages the tissue. And we're talking about cardiovascular disease because it damages the vessels, but we're also talking about cardiomyopathies because it damages the actual heart muscle. So these are some really serious side effects that, if radiation is going to save your life, then of course you accept some of these side effects. But what if it isn't? Because we have data coming out in the last couple of years that says that radiation does not impact survival. And survival is the only thing that matters. Nothing else matters, right?
Right.
So if it is not impacting survival, what are we doing? Why are we doing it? And these are the questions that have to be asked. So in my book, I give you questions that you should ask your medical oncologist, that you should ask your radiation oncologist before you do these treatments. And one of the main messages in my book is that, when a woman gets those 4 words, "You have breast cancer," the rug gets pulled out from under her, right? This is probably one of, if not the biggest stressors that a woman will, right? When we are in this stressed state, the state that we talked about before, and your blood is shunted to your muscles so that you can run away, it's not here. It's not in the thinking part of your brain. Because if you need to run away from a tiger, you don't want your brain saying, should I make a right or a left? Should I go this way or that way? Do I need to pick up my dry cleaning? Like, right? You don't
Yeah.
want your brain thinking about that. You just want run. So we put these women in this horrible stressed state and then ask them to make the most important decisions of their life, right? And they can't think. So I think the best thing that everyone who gets a breast cancer diagnosis can do is take a pause, take a breath, get educated. Nothing is going to change in a week, in a month. Probably nothing is going to change in 6 months for most women. There are some very aggressive cancers. I am not saying that there aren't. And in those circumstances, yes, you need to act quickly, but they are few and far between. They are rare, right? And so most women do have the time and the space to learn about their disease. And it's true of men too. Like we need to not jump on treatment right away. We need to educate people so that they can understand the natural course of the disease and make the decisions that feel right to them. Because whatever decision you make, like most breast cancers are curable. So whatever decision you make, you're going to be living with that decision for a very long time. It ought to be the right decision for you.
Yes. And you bring up a point, and this is sort of what kills me is that you say to ask the questions, right? Well, these are also questions you have to ask yourself, because a lot of times you will ask these questions of your doctor and they will blow them off. They will, make you feel like treatment is urgent. All of these things are urgent, and they will make you they'll dismiss the questions. Or in my case, when I asked certain questions and they didn't have an answer, I was horrified. I was absolutely horrified when my
I
doctor
know.
said, don't ask why this happened to you. He literally said that out of his mouth. Don't ever ask why. And I thought, are you crazy? This is crazy. And it's
I
when I
know.
kind of realized, like, I had to be resourceful and use him for what his knowledge that he had. And I had to go out and find other resources, because unfortunately my insurance wasn't allowing me to take the time or to have better, a bigger portfolio of doctors, for lack of a better term. I didn't have that freedom to go meet with all these different doctors. I had to do it on my own. And a lot of people are frozen in fear with breast cancer, and they
Yes.
don't do the research. And in my case, I was told that I needed surgery. I couldn't have surgery, and I needed treatment immediately, and it was spreading fast, and it was aggressive, and all of these things. um and so what I did is, in my research, is I more like researched how to get through the treatment and how to help my body along with the treatment. But it was always treatment oriented, right? It wasn't like, what if I opted not to do the treatment? It just was, I have to do that, but I'm also going to do these other things at the same time. And,
But, interesting, because what everyone gets is a treatment plan for sure, right? But what everyone needs is a health plan. And I am not against conventional treatment, by the way. So I think that everyone is individual and what everyone needs is individual. And I'm not throwing the baby out with the bathwater. There are absolutely positively situations where people have aggressive disease and they need aggressive treatment. But in that person needs support through their aggressive treatment. And the garbage information that they're getting from most medical oncologists, I'm not going to throw all of them under the bus, but most medical oncologists say things like, it doesn't matter what you eat, or no matter
eat
what
what
you
you
do,
can.
don't lose weight. And instead, they should be talking about fasting through chemotherapy, because we know that fasting not only decreases the side effects associated with chemotherapy, but it also increases the efficacy and decreases your reliance on the prescriptive drugs that often go along with chemotherapy, like steroids and things like that, that we know ultimately hurt you, right?
Right.
Because steroids are immunosuppressive. And the
Right.
reason that they give them is so that you don't react to the drugs. But you can accomplish that with fasting,
Yeah.
because when you're in a fasted state, when you get chemotherapy, your normal cells are at rest. They're not taking up that chemotherapy, and they're not particularly affected by it, especially your GI tract especially your GI tract. So all the nausea and that kind of stuff that goes along with chemotherapy can be avoided if you get chemotherapy in a fasted state. And there's data on this that has been around for years. I mean, Walter Longo at USC has been publishing on this for years. And yet, why has the mainstream not adopted it? Why are they still feeding people in chemotherapy centers? Why are they still giving out Boost and Ensure at
Yeah.
chemotherapy centers? Garbage,
Yeah.
garbage that only increases tumor production, right? It's
Yeah.
only feeding these processes for the most part. So it is so amazing to me that there is such a disconnect. Now, listen, I know that they're not taught that in school. I went to the same school they did, right? But I think at some point, we need to take some personal responsibility. The information is out there.
Mhm.
We need to do better.
Mhm.
Collectively, we need to do better. And there are supplements that make chemotherapy better. Why aren't we using them? Why aren't people getting high dose vitamin C infusions at their chemotherapy center? They should be. We
I
know it
asked
makes it better.
I asked, and my oncologist said, "Absolutely not. Stay away from it. Don't take any vitamins. Vitamins will feed the tumor."
Okay. So
The wildness.
this is where I don't know and no gets confused. And this is what they are
Yes.
notorious for. When they don't know, they say no. And anyone who says vitamin C will feed tumors doesn't understand high dose vitamin C, because low dose vitamin C is an antioxidant. And most chemotherapies work by creating this oxidative stress that kills unstable cells. But high dose vitamin C is a pro-oxidant. It just so happens that normal cells are unaffected by high dose vitamin C, but cancer cells are affected. And so they make the cancer cells even more vulnerable. And then you can give low dose chemotherapy and get the same effect that you would with high dose chemotherapy and less side effect. But it means that they have to start to think outside of the box. But as the information changes, so too must our minds. We have to continue to grow with the information. And,
Yes.
that kind of leads into the whole mammogram thing, because not for nothing, but certainly in the breast cancer population, and it's true in the PSA prostate cancer population as well. We are creating some of that disease. In the breast cancer population, we're creating 20 to 30% of the breast cancers by using mammogram to screen. 20 to 30%. So if we treated 300,000 women last year in 2024 for breast cancer, that means that 60 to 90,000 of those women were diagnosed and treated unnecessarily because we are using mammogram. And it has been definitively proven that mammograms do not save lives. Definitively proven. They are
I'm here.
radiation. At the end of the day, they are radiation. Now, there's always going to be the person that chimes in and says, "Mammogram saved my life," or "Mammogram, it was my first mammogram that found my breast cancer." I'm not saying that mammogram causes every cancer. Okay, that's a ridiculous statement. I am not making that statement. But I am telling you that if you take 10,000 women over 10 years and you screen them with mammogram, you will save 4 lives, maybe save 4 lives, and you will cause 120 to 140 women to be unnecessarily treated for breast cancer. These numbers are insane. They're intolerable. And we should not be using mammogram to screen for breast cancer. Absolutely, positively not. We are creating this disease for women, creating it. These
And
women
let's
would have
also
never presented.
And let's also not leave out the fact of people like myself. This happens very much. My cancer was completely missed by the mammograms. So I was
Yeah.
having them and they didn't see it at all.
Yes. And
So
this is a major problem, because in 40% of women, mammogram will miss cancer. And that is the dense breasted population, which is 40%, right? So this is a large number who go and have a mammogram and have some false sense of security that everything's fine, and everything's not fine. And it's not like we don't have ways to screen for breast cancer that are 100% safe and far more reliable than the mammogram. We do. We just have a system that's fighting against it.
yes. And so let's talk about that, because I really push self-exams to do self-exam. If I had been doing the self-exams, I would have found mine.
Yes.
So I kick myself all the time. So
Yes.
besides doing, because there are some breast cancers that you might not feel, so a self-exam is not going to detect that. So let's talk about what imaging you do
So
promote and you do believe in.
I have a triad, right? Self-exam is absolutely part of it. No one is ever going to know you better than you know yourself. Newsflash, every single woman thinks her breasts are lumpy. You just have to own your lumps, right? Know what your breasts feel like when they're normal so that you can recognize when they're abnormal. And then if you are premenopausal, you're doing your exam day 7. So if your first day of your period is 1, count to 7, and that's when you should examine your breasts. If you're postmenopausal, you just do it on the first of the month or whenever you're going to remember. And you both look at your breasts and feel your breasts. And you're looking for changes in the appearance, size, shape, that kind of thing, any nipple dimpling, nipple inversion, skin dimpling, redness, anything like that. You're looking for a change and you're feeling for a change. So everyone should be doing self-breast examination. The second thing I do in everyone is called the ARIA test, AURIA. It's aria.care. And if you use my code Dr. Jenn 20, DRJENN 20, you'll get 20% off. It's a totally affordable test. I think it's like $130. This test screens for the inflammatory precursors of breast cancer. So if you have an abundance of these proteins, the S100A8 and S100A9 proteins, you are at increased risk for breast cancer if you don't have it already. So you take a sample of the fluid in your eye. It's just a tiny piece of paper that you put inside your eye, close your eye for 5 minutes, take the paper out, send it off to the company. A week and a half later, you either get normal or clinically significant. If you have a clinically significant result, you need imaging. If you don't have a clinically significant result, you're really done there with self-examination and the ARIA test. You don't need imaging beyond that. But if you have a clinically significant result, go have either an ultrasound or a QT scan. I opened up the first Perfection Imaging Center in Philadelphia in 2024. I am opening 50 across the country. I have another imaging center in Nevada. It's called Perfection Imaging, and Perfection is spelled with QT in the center. And this uses sound waves transmitted through a water bath that creates a true 3D reconstruction of the breast with 40 times the resolution of MRI. It is FDA cleared, and it is completely painless, radiation free. It's like going to the spa, except at the end, you get to find out whether or not your breasts have anything wrong inside. So this is absolutely, positively the imaging of the future. I have no doubt about that. And I'm going to spend the next 5 years of my life making sure that everyone who wants access to this test gets access to this test. But nowhere in this triad of screening, self-examination, the ARIA.care test, or the QT scan or ultrasound, nowhere in any of that does a woman experience any pain, any discomfort, or is she put in any danger in any way, shape, or form. You cannot say that about a mammogram. Mammograms are radiation. Radiation is a known carcinogen. So we know that the more mammograms you have in your life, the higher your risk is of getting breast cancer. Let me just say that again. The more mammograms you have, the higher your risk is of getting breast cancer. Every mammogram you have increases your risk of breast cancer. Okay? That something that is safe does not put you in danger. Something that is safe does not put you in harm's way. There's a lot of justification going on out there. People talk about that it's the same amount of radiation as a cross-country flight, and you would never tell someone to not go on a cross-country flight. Yes, that's true. I would never tell someone to not go on a cross-country flight. But when you go on a cross-country flight, that's scattered radiation. That is completely different than the focused, coned down radiation that you get to the tissues of the compressed, traumatized breast. And I don't want to hear that my mammogram didn't hurt. If you put 20 to 50 pounds of pressure on the breast, it's traumatized, whether you felt it or not, right? And when you radiate the traumatized breast, you are causing cellular and DNA damage. That is how cancer starts, right? So it is not the same as a cross-country flight. It's not even close to the same as a cross-country flight. And we have to stop using these justifications for a technology which should have been abandoned long ago. Because as we talked about with radiation, the only thing that matters is survival. That's the only thing that matters. And screening with mammogram not only doesn't increase survival, it decreases survival because we're actually causing disease and causing dysfunction.
Yeah, and that's going to get a lot of kickback because you're just told over and over and over again, get your mammogram,
Yeah.
have you got the mammogram? And
I'm
it's
used to getting kickback.
Yeah.
I do
Me
want to
too.
say something about the MRI though, because we talked about, that QT is 100% safe. The RES dot care test is 100% safe. Mammograms are not safe, and neither is an MRI. Now, the MRI itself may be okay, although I do worry about that magnet. And we know that people who work around that magnet have an increased risk of cancers. Um, but maybe once a year exposure isn't that big a deal, but the gadolinium is a big deal. And the gadolinium that is given along with the MRI, that's a heavy metal.
It's the
And
injection for people. You get an
yeah,
injection for they call it
yeah,
contrast screening. Yeah,
yeah. And
sorry.
I don't think the value is there in the MRI without the gadolinium. I think it needs the gadolinium in order to have value. And when you give the gadolinium, you make that test not safe.
And, Dr. Jenn writes in her book, if you're someone like me, who has already done it, the damage is done. There are so many ways to help combat. And I want to talk about the heart health a little bit too, because it's a big worry on my plate. But I wish I'd had your book sooner, because there are things you can do if you are going to get your MRI, you are going to get your mammogram, you are already scheduled to do these things, or you feel like you must. There are things you can do to help your body along with those as well. And it's a big deal. It makes a huge, huge deal. Just like the fasting. So I fasted with chemo, but I also took all of the anti-nausea meds ahead before, and I never felt any nausea. And I actually gained a lot of weight. And when I lost weight, my doctor became very concerned afterwards, because I gained the weight from all the steroids.
Yes.
I blew
Yes,
up so
that's
fast,
correct.
50 pounds.
And
50.
and that's just ignorance on your doctor's part, because they think they associate weight loss with cachexia, which is a state where people are in a very high metabolic state because they have very advanced cancer, right? But most people going through treatment need to lose weight. Losing weight is beneficial to them.
Yeah.
And the doctors need to start to, all the providers, they need to start to separate what is healthy weight loss and what is not healthy weight loss. Because if you need to lose weight and you have a cancer diagnosis, the time to do it is now. You
Mhm.
need to get that weight off. You need
Yeah.
to establish your metabolic health. If we screened for metabolic health with a fraction of the energy and resources that we screen for cancer, we would be a far healthier society, because metabolic health and metabolic dysfunction is what's driving 80% of cancer. 80%. And if we
It's
could
huge.
correct that, and that starts with normalizing your weight.
Yeah, because people don't realize, your doctor will tell you, eat, eat, eat. You need to be strong. And the thing is that weight gain is a huge contributing factor to cancer.
Of
And so
course.
when I was freaking out when I gained the weight, and my mission was to get it off as quickly as possible. And, and then he sat me down concerned, and I said, it's my diet, it's my fasting. And he doesn't want to hear it. But we could go on all day long of all the crazy things that they tell you. Like, they tell you to not deal with pets and get rid of your pets if possible when you're going through chemotherapy. What's more traumatic at such a horrible time is getting rid of your pets. Like, I
It's
did not get rid of
but
my
this
cat. I looked at my
ignorance.
13-year-old and I said, you're
I know, I
dealing with all
see
the
your
poop.
cantaloupe behind you. Of
I'm not getting rid of her. I'm not going to traumatize
course
myself
not.
more. My friend who was in we lost her, unfortunately. She was diagnosed with colon cancer, got rid of her dog, and was traumatized even more about the
It's
dog.
just
And
such ignorance.
it's so horrible, and she believed it. And you can only talk till you're a certain shade of blue. But
I know.
this also brings me
Good.
to, you talk about lifespan, and they do this a lot, a 5-year lifespan. I feel like my friend was an exact example of this. She said, I want to live to watch my daughter graduate middle school. As soon as her daughter graduated, and she was fine. She was dancing at the graduation parties in heels, dancing, looking vibrant, looking happy. And maybe that's just, for a short period of time during the day. I don't care. She was looking like that. And she died very quickly after her daughter graduated. And I think that
I
this is
I
very
I
important.
tell this story in my book of this woman who had widely metastatic disease, right? And I think when her daughter was 10 or something like that, she was diagnosed. And I actually inherited her from a predecessor of mine. And all she kept saying was, I just want to live to see my daughter graduate high school, which, her daughter was young. So she had a ways to go with widely metastatic disease. And I didn't realize at that time, because I was too early on in my career, I was like, well, I think that's a great goal. Not thinking that, like, why are you capping your goal? And she lived to see her daughter graduate school. I mean, I operated on her like 5 times over the years, and she died the next day after her daughter graduated. And it's like, we need to set our sights so much higher.
Yeah.
Like, you don't have to cap when you're going to live, and know how powerful that is, how powerful our minds are, how powerful our intentions are, right?
Yeah.
Like, the
Yes.
number one predictor of how long you're going to live is how long you think you're going to live. And you're
Yeah.
in control of that. You're in control of so much more than you think, so much more than you believe. I am pretending that I did not just see that plastic water bottle.
You guys are killing me. And Nicole, I bought a brand new Apple Watch the other day. Now you're all in my head.
Oh,
Oh,
Damn it.
dang. Look.
Ah, oh, you
thank you.
guys are giving me such a hard time.
Well, it's
Sorry.
all these factors. You have to look around the house, and you can't overwhelm yourself with it, but you do have to look around you and just swap things out. And it is important to have goals and things to live for, but yeah, let's not cap it off at, a certain time period, because yes, your body, what you're feeding your thoughts and your body with your mind, and it's so important. I also want to talk about heart health really quickly here, because
Yeah.
Dave, I don't know if you know, but I've been reading a lot about this lately, and it's scaring the crap out of me. Women, so we'll survive cancer, we'll survive breast cancer, and then we turn around and die of heart disease.
Yeah. So heart disease is actually the number one threat to a woman's life from the time that she's 30 on, right? Exponentially,
Yeah.
the threat to a woman's life. And then, she gets a breast cancer diagnosis, and it's actually the same thing that leads to the breast cancer diagnosis that leads to the heart disease diagnosis, right? It's that chronic inflammation. And when all you do is cut, burn, and drug the breast cancer, you never acknowledge, deal with, intervene in that inflammatory process. And so, these women go on to get heart disease. And some of them, they go on quickly to get heart disease because all of these treatments for breast cancer actually accelerate heart disease. And one of the biggest problems is that almost all the treatments for breast cancer render a woman menopausal. So if you weren't already, then the treatments often render you menopausal. And it is a lack of estrogen that is actually driving the cardiovascular disease. It's also driving the neurodegenerative disease. It's also driving the bone disease. And lest we forget, like, the same number of women die as a complication of a fracture every year. So we cannot discount the bone disease, right? And for decades, for as long as I can remember, women who are treated for breast cancer are excluded from the hormone replacement conversation. And that ends now, because we know, and we have the data to show, that taking hormones does not put you at increased risk of getting breast cancer. And taking hormones after breast cancer, even when you've had hormone positive breast does not increase your risk of recurrence, and you have better long-term outcomes. You have better survival outcomes. So we need to be having this conversation often. And women who are treated for breast cancer need to be considered for hormone replacement because we do not want them to undergo rapid deterioration of the health of their blood vessels, of the health of their heart muscle, of the health of their brain, of the health of their bones, their gut, their skin, their muscles, their joints, their bladder, their vagina, right? Like, there is a reason why we give hormone replacement. And for too long, the pharmaceutical industry has capitalized on this whole hormones are bad narrative. And believe me, I understand why they did it. Like, why give hormone replacement when you can put someone on an antidepressant and an anxiolytic and a sleep medication and something for palpitations and something for reflux and something for bone health and something for bladder, and on and on and on it goes, right? So we need to be having this conversation about hormone replacement for everyone. Now, I'm not saying that we should just be handing it out willy-nilly. And I also think that it has to go hand in hand with making sure that you are eating in a way that's nourishing you, that you are moving your body, that you're prioritizing sleep, that you are detoxifying and getting those plastic water bottles out of your house, and
I believe.
not cooking in nonstick, and getting the fragrance out and the antibiotics and all the other things that we know contribute to disease. Like, the diet and the lifestyle pieces have to be there, but hormones have to be part of the conversation. And
Yes.
it's time to turn this back around, because women who have had breast cancer are people too, and they deserve the same consideration that everyone else is getting. I actually reached out to Oprah's team last week because, she has this big focus on menopause, and she has the menopause on, right? Like, there's 8 or 9 individuals who are kind of owning the conversation. But what the menopause isn't talking about, and what Oprah didn't talk about, is that, one of the reasons why people aren't open to the conversation about how do you deal with menopause and how do you prevent all the dysfunction is that they're afraid of breast cancer. Well, bring me into the conversation, because you don't need to be afraid of breast cancer, because people aren't getting breast cancer because they're taking hormone replacement. People are getting breast cancer for other reasons. But listen, after the Women's Health Initiative, when 80% of prescriptions for hormone replacement went away overnight, what happened with breast cancer rates? They went up.
Okay.
They didn't
Yeah.
go away. They got worse.
Yeah.
They got worse, right?
Yes.
Because estrogen is protective. Estrogen is the hormone of life. And we have to continue to provide it for women, even if you've had a breast cancer diagnosis. Breast cancer is not a disease of hormone excess. It's a disease of hormone deficiency.
But you
Same
will be
thing with
told,
prostate cancer.
you can be told it is, like I was told, estrogen caused my cancer. It's an estrogen-driven cancer.
Yes,
So
it's
I'm
a
on
very
3,
convenient narrative.
isn't it? And then I'm on 3 medications to block the
Yes, they can
estrogen.
sell
Now,
you lots of drugs.
yes, and we're on it, and and I say we because I talk to a community of women about it, and we're all suffering, and we're all in pain, and all of these things and the side effects. And like radiation, this set off an alarm in my head. I said, I don't want to be estrogen deficient. Like, I'm scared to death. What does this mean? Went to meet with a gynecologist, obviously the wrong one, because he just looked at me and laughed and was like, you're old. You're old. Your female parts don't work, and I don't know what. And I was like,
Yeah.
oh my God, I need to get out
I'm
of this
too much
office.
of a lady to say what I would have said to that guy, but I
Oh,
can tell you that there's a certain I would have told him to read between the lines.
yeah. I mean, it was very hard not to. I had to get up and leave. But
That sounds about
so
right.
this is a very important step for me, and I'm sure a lot of other women are standing here in my shoes too. Is what do we do? What do we do from here? We know that the estrogen blockers are bad for so many reasons, but they tell you, oh, it's only one of them's 3 years, one of them's 5 years, one of them is 10 years for me. And I'm told I can avoid the 10-year one if I get a hysterectomy. And you're standing here going, okay, what do I do? And it's a very important conversation that needs to be had that is not happening. We just accept it. And
I know.
it's dangerous and it's scary, and I'm very scared of getting heart disease. And I I didn't come this
And
far
as
to
well
just
you
come
should
this
be,
far.
right?
Yeah.
Yeah.
Yes.
Yeah. And what's even scarier when we think about the statistical um, attention that it's given, these women who are treated for breast cancer and then develop heart disease, that even though it's the treatment that caused their heart disease, that death is not attributed to breast cancer. So they are said to have survived breast cancer.
That's right. It's
And so it's like no one's taking responsibility for what they're creating. And that is a major problem. And I think that if we instead had some accountability, and this is across the board with pharmaceuticals, we need way more accountability. Lest we forget, the number 3 cause of death in the United States is polypharmacy, and it's using correct pharmaceuticals prescribed correctly, but polypharmacy, and this one's not talking to this one. And that's the number 3 cause of death in the United States. This is a problem. This is a
a big
problem.
problem.
And we have to get beyond, this pharmaceutical nightmare.
We
Really.
really do. We really do. And I really, and shoot me for saying this. I really feel like cancer, MS, so many things, all this autoimmune that we're all experiencing. I feel like it's all very avoidable. I think it's preventable. I really do. Men, women. I mean, let's start with our cooking pans. Yeah, it's one that none of us, we think we're doing so great for ourselves by cooking at home and have this healthy meal. And you're killing yourself with the stuff that's the nonstick. You're killing yourself when you put the stuff in the microwave and then you stand there for it to be done. The Bath and Body Works, that ladies, that you're getting such a good deal on, the buy one get 3 free, and it's killing you. It's killing you. The stuff you're
Yeah.
putting on your hair, your
Yeah.
skin,
That's some
you're
of the
eating,
most toxic stuff there
killing
is.
you. Yeah, it's
Yeah.
unbelievable. It's
If you love your
absolutely
friends, don't give them a gift basket from
Bath and Body Works, especially.
no.
No, and
That is
and
pure
I do a
garbage.
big segment here on dupes. I do a product alert, but what people also need to understand is that we want beauty on a budget, but you can do that being healthy as well. We're not going to the Dollar Tree and buying it because the packaging looks the same. It's not a dupe. That's not what makes it a dupe. What makes it a dupe is the ingredients inside. And these are just all things that it's convenience, and we fall into it, and we've got to get out of it. And I appreciate you so much for being there and being a resource. And tell everybody your website.
Yeah. So you can see me at realhealthmd.com. And then for anyone who is looking for that scan that I talked about, it's Perfection Imaging, PERFEQTION imaging.com. And I'm on all the social media channels at Dr. Jenn Simmons, and my Jen has 2 N's. And then I have a podcast called Keeping Abreast with Dr. Jenn that I hope to have you on very shortly. And we release a new episode every week. So, there's lots of places to find me. And of course, my book, Keeping Abreast with Dr. Jenn. And you don't even have to, The Smart Woman's Guide to Breast Cancer. You don't even have to have a breast cancer diagnosis, because I really wrote this book for the purposes of educating everyone about prevention, about how to not get a diagnosis. Certainly, what to do if you do get a diagnosis, but prevention is a large part of this book. And so anyone with breasts will get benefit from reading this book.
Absolutely, and I gotta say, it's an easy read. It's a self-explanatory. It's not one of those books where all of a sudden you're overwhelmed with all these medical terms and you're lost and you're bored and you're tuning out. It is very straightforward. It's very easy to understand. It's a great for gift to give to everybody. It's a great gift to yourself because, yeah, like I said, I wish I had had it before I started treatment, but here we are, better late than never, and there's so many good tips on it's such a good guide. It really is. So I thank you for that.
Thank you. Thank you.
Thanks for joining us.
Amazing. Thank you so much for having me.
Yes.
That was really cool. That was cool. That was very informative. The one thing is, you and I were talking about is, when she talked about capping as far as, capping your goals. My closest friend just passed away a short time ago, and I remember him and I talking, and his wife talking about how he wanted to be around to see his granddaughter being born. And sure enough, his granddaughter was born, and just a short time after, he was gone. He that was the goal, and he fought like crazy, and he went longer than what the doctor said he would go, but he saw his granddaughter, and then that was actually, it's my favorite picture of him holding his granddaughter, but that was the goal, the cap.
Yes, but unfortunately, your friend, it was so advanced, right? Like, that was probably buying him some time, but it's for people that just get their diagnosis and then they're like, oh my God, I have to, I have to live to see my daughter. We can put our goals like, no, I want to live. I know that I can deal with this, and I'm just so big on that. It's preventative. It really, really is preventative. You just have to be open to it. You have to not get overwhelmed with things, and you have to start small and realize that it's preventative. Just like for me, when I got my diagnosis, I knew I knew I was horrified by it, but was I completely shocked? Let's be honest. Nope. No, I was not. And I will get more into that later. There's so much I want to talk about and share with people later, but I still am building my arsenal, and I'm still getting there. I'm still working on myself, but yeah, let's start. Men, women, all of us. Let's just start with the little things. And look at you, Dave. Look at you without your wireless earphones.
Oh my
And
gosh!
don't put your phone in your pocket. Just don't put it in your front pocket, please.
I never do anyway. I just hold up my hand, so I'm probably going to get it through my hand.
No, you're not going to get hand cancer. That you're not going to get.
But
But you will get
literally, I
tested.
bought a new watch. You guys are killing me on the watch. It's like everything. I was sitting there. I was like, "What do I do now?" Then I drank the water out of the bottle, and
the
she
damn
caught me.
plastic.
I didn't think she was paying attention. I was like, "Oh no!" As soon as
And
I put it in my mouth, I knew she was going to say it.
and it's a lot of these things are convenience, right?
Of
Those
course,
plastic water bottles
of
are for
course.
convenience. You're
Yeah.
killing our environment and you're killing yourself. It's
Everybody
wild.
goes out with me. That's why I look at it. No, I'm sorry. Just
Well,
kidding.
there's glass and metal. There's glass and metal. They
I
exist.
know, and I have a bottle like she has. I have 8 million of them in the house. I know. I did it wrong. I
See,
have no
I
excuse.
prefer to drink my water out of glass.
Yeah.
And so I actually just bought from Amazon a glass thermos, and it's has padding around it so that it won't break. In the house, it's look at, I'm
Yeah.
holding up a giant mason jar for those of you who are not watching, only listening. I have a giant mason jar that was just sitting in my cabinet, and I use that because I prefer glass, and it's so much healthier.
Yeah.
And we talked about the castor oil. If you're going to do the castor oil, make sure it's in a glass bottle. Same with your olive oils. All of these things, they're sitting in this plastic, and they're forever plastics. And then you ingest it and you think you're doing something healthy for yourself, and instead you're ingesting more plastics. It's the end of my rant for the day. I know it was a
Okay,
lot.
thank you.
It was a lot, but it's my life mission at this point.
I get a lot of this at home. You just so you know, I get a lot of it at home. I know as soon as I say goodbye to you, I'm gonna get the same thing for my wife later on. So it made me laugh. That it's like what I do now. There was one of those. It was a good time, but it was like, oh no, I got a lot of faults.
Yeah. And we do because it's
Yeah,
just they make everything so easy and so convenient. And yeah, put it in the microwave. It'll take 5 seconds. Whereas if you do it on the stove, it's going to take 5 minutes. Are we really in that big of a rush, folks? Listen, there's an occasion where I throw my coffee into it before I go to carpool because I'm going to be
yeah,
a
of
much nicer mom on that carpool drive if
course.
I've got my hot coffee. But in general, no, I don't use it. We just don't use it. I don't even think to use it, to be honest. And it's the first time we've lived with one in many, many years. And it's because it was built into the kitchen.
Oh, that's funny.
I've never purchased a microwave.
Is
So
that
these
right?
are just things.
Wow,
Yeah. My little one doesn't even really, she doesn't know it's there either. She pulls out pans and goes to the stove. It's
man. I
because she
see.
was
I
raised
don't.
that way.
I'm lazy that way. My attitude is if it takes longer to make it than to eat it, it's not worth it. So I'm just constantly just going. I'm Mr.
But you're
Microwave.
changing the molecule makeup of your food.
I know I
Um,
am. I know I am.
and microwave was used as a weapon, like a weapon with the CIA and things like that. They would they would direct microwaves into people's
Yeah.
apartments. Yeah, and poison them to death like that. It's
Yeah.
it's a very real thing, folks. So thanks for joining us. It's important conversations. It really, really is. I can't stress it enough. And I'm somebody that I thought was healthy, and I look back and it's so avoidable. All of this is so avoidable. So I hope you take something away from today and enjoy your day, enjoy your week, and we will catch you next week.